back, guys. I'm Dr. Lindsay, a small animal veterinarian, and I promised you a video on Maine Coon health issues. So I'm gonna go through the top 5 Maine Coon health issues, and you guys are gonna learn a ton in this video, so stay tuned. So before we get started, I wanna thank this video's sponsor, which is Pet Meds. So let's get learning about the 5 health issues of Maine Coon cats. So I'm here with my Maine Coon superstars, Lily and Ivan, and let's get right into it. So number 1 in Maine Coons is gonna be hip dysplasia. You may also notice a swaying gait when they walk due to the attempt to avoid joint pain. Your veterinarian can help assess your cat and take hip x-rays to see how severe their hip dysplasia is. You can feed your cats joint support supplements like glucosamine and fish oils, as well as get prescribed pain medicine from your local vet. But the most helpful thing for Maine Coon cats with hip dysplasia is keeping their weight normal and keeping them lean, so they have less mass contributing to progressive arthritis and pain. Number 2, hypertrophic cardiomyopathy, or HCM, which is common in all cats, but particularly common in larger breed cats like the Maine Coon. HCM is a condition that causes the muscular walls of the cat's heart to be thickened, decreasing the efficiency of the heart and disturbing circulation throughout the body. Most cats with HCM have no symptoms and may live a long, normal life. However, some cats may also die suddenly from this disease too. The most deadly health issues associated with HCM are blood clots, especially to the hind limbs, causing paralysis, which is rarely recoverable, and most cats are humanely euthanized. In cases where HCM leads to congestive heart failure and there's fluid accumulating around the cat's lungs, Maine Coons will act lethargic, experience open-mouth breathing, or labored breathing. Your veterinarian will initiate treatment to get fluid off the lungs using diuretics and oxygen support, and try their best to stabilize your cat. From there, your cat will need an echocardiogram or heart ultrasound and possibly a veterinary cardiologist to follow up with. If you're worried about HCM and you're getting your kitten from a breeder, you can request an HCM heart test that is a simple mouth swab sent to UC Davis Veterinary School. So even if the cat is negative for HCM on that swab test, they still can develop HCM, but it is a good way to rule out that the cat doesn't have it genetically. Number 3, spinal muscular atrophy in Maine Coon cats, or SMA. This is an autosomal recessive disease, meaning that both parents need to be carrying the mutant gene to pass this on to the kittens. Spinal muscular atrophy causes the loss of spinal cord neurons that control muscles in the limbs. This leads to muscle weakness, and clinical signs become apparent by 3 to 4 months old, so young kittens develop this disease. This disease is not thought to be fatal, however, or painful, but most cats with SMA can still live a somewhat normal and more sedentary life indoors with a recorded lifespan of 8 to 9 years old. There is a PCR test available that tests for the SMA genes in Maine Coon cats, and you can ask the breeder to test your kitten or the parents before you bring your cat home. Cats that are carriers of SMA can still be bred to non-SMA carriers and have perfectly healthy kittens. Number 4 is parodontal disease and stomatitis in Maine Coon cats. So stomatitis is a painful disease of the gums and around the teeth. We don't know the exact cause, but suspect it may be autoimmune for cats getting these oral diseases. But both cause a painful mouth where the gums are infected, red, and inflamed, and the dental ligaments of the teeth are also infected and wear down. It's also common that their teeth can resorb and fall out on their own. Maine Coon cats with dental disease may cry while eating, drop food, or stop eating altogether because their mouth is so painful. They may also have bad breath, paw at their face, have a messy coat and fur from lack of wanting to groom due to oral discomfort, and of course, weight loss. If you notice this, bring your cat to the veterinarian for a professional dental exam and cleaning. Depending on how severe the disease is, your cat may need full mouth extractions or simply a cleaning and antibiotics. Before we move on to number 5, I'm gonna sneak in kidney disease. And this goes for all cat owners out there. They should be doing a blood test on their cat around 8 to 10 years old to check their kidney values, because 35% of cats will get kidney disease over the age of 10 years old. So that is something I just wanted to add in this video. There are other articles about polycystic kidney disease in Maine Coon cats, but that's more seen in Persians, so I'm not gonna touch on that in this video. So let's move on to number 5, which is obesity in Maine Coon cats. Maine Coons, being a large breed cat, can get very large and even too large. They love to eat and are social with the family, probably leading to them getting more treats and gaining even more weight. Maine Coon owners specifically need to be cautious of their cat's weight and to keep them lean so they don't struggle with all the other diseases I named on this list. If you're worried about your Maine Coon cat's weight, bring them to the veterinarian and have them lay hands on them to let you know if they need to lose weight. There are also many weight loss diets out there that you could put your Maine Coon cat on. Alright guys, so you just learned a ton about the health issues of Maine Coon cats that you may not have known before watching this video. I want to thank Lily, who's so beautiful, and Ivan, this sweet Maine Coon kitten, for being in my video today. They did a great job. And if you guys have any questions about any of these Maine Coon health issues, leave them in the comments below. I'd be happy to answer them for you. And like always, subscribe to my channel, like this video so other cat owners can see it, and I'll see you guys next time for some more breed-related health issues.